As the top killer in America, cardiovascular disease claims one life every 30 seconds. Every year, hundreds of thousands of people die from sudden cardiac arrest. Most incidents occur at home, but a heart attack can happen at work, while traveling, or during recreation. Just a few years ago, the only actions people with little medical training could take to help cardiac arrest victims were call 911 and start CPR. Now, early defibrillation by lay rescuers using an automated external defibrillator, or AED, helps save lives. The next program segments show how the heart works, the common elements among all AEDs, how to operate an AED, special issues affecting AED use, and how to properly maintain an AED. The heart is a muscle with 4 hollow chambers that pumps blood throughout the body. An electrical conduction system coordinates its regular rhythmic action. Complications from heart disease or from sudden events like electrocution may disrupt the body's electrical signals to the heart. The result is abnormal heart rhythms, disrupted circulation, and potential cardiac arrest. After 8 to 10 minutes of arrested circulation and abnormal rhythm, damage may be so extensive that survival isn't possible. The 2 most common abnormal heart rhythms are ventricular fibrillation, or VFib, and ventricular tachycardia, or VTAC. Ventricular fibrillation is chaotic, uncoordinated electrical activity. VFib stops blood circulation because the heart can't pump any blood. Ventricular tachycardia means the heart beats too fast. VTAC stops blood circulation because the heart can't pump effectively. Because both VFib and VTAC respond to defibrillation, the earlier an AED can be used, the greater the chance a victim will survive. Automated external defibrillators, AEDs, are electronic devices that analyze heart rhythm, determine the need to shock, and deliver a shock through cables and pads placed on the chest. AEDs vary from basic units that lay people can operate to those with advanced features helpful to professional rescuers. All AEDs have common features, including a power button to turn the unit on and off, cables and electrode pads to attach to the victim, capacity to analyze heart rhythm, capacity to deliver a shock when needed, voice prompts to guide users through the procedure,
shock advised,
and the capacity to store and retrieve data. AEDs are simple to operate. With only a few buttons and voice prompts as a guide, using an AED is easier than giving CPR.
Do not touch patient. Evaluating heart rhythm.
AED voice prompts tell you each step to perform. You don't need to remember the process.
Everyone clear. Preparing to shock. Press flashing button.
Regardless of AED make or model, all units follow the same basic steps. Turn on the device. Apply electropads to the victim's bare, dry chest. Analyze the heart rhythm and deliver a shock if indicated. Before using an AED, determine if the victim is unresponsive and not breathing. Then perform CPR until an AED is available. Once an AED arrives, stop CPR, turn on the device, and follow the prompts.
Call for help now. Check for breathing. Remove all clothing from patient's chest. Look at pictures on pads. Peel one pad off blue plastic. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Check pads for good contact. Do not touch patient. Evaluating heart rhythm. Charging. Everyone clear. Delivering shock. Shock delivered.
When operating an AED, follow the established procedure for that device. Typically, you'll give one shock followed immediately by 2 minutes of CPR, then reassess. Repeat this process until emergency professionals arrive and take over. Familiarize yourself with the operation of your specific AED so you recognize its prompts and can check or correct unexpected messages.
No shock advised.
A no shock advised prompt means the AED wasn't able to detect a shockable rhythm. Begin CPR.
Motion detected.
A motion detected prompt means you need to check that no one is touching the victim and that the victim is still unresponsive and not breathing.
Check pads for good contact.
Check that the cable is solidly attached to the AED and that the electrode pads are securely attached to the victim. If the electrodes are in place and the AED voice prompts indicate a problem with electrode placement, hair may be getting in the way of direct contact between the electrodes and chest wall. Use a razor to quickly shave the hair in the area of the pads. Using an AED requires awareness of some special issues, so you can take appropriate action and precautions. We'll discuss using AEDs around water, the age of the victim, trauma, victims wearing medication patches, implanted defibrillators or pacemakers, and do not resuscitate or DNR orders. Whenever water is near a victim of cardiac arrest, quickly move the victim away from standing water. Dry the chest and apply the electrode pads. As long as the chest is dry and the pads are firmly attached to the chest, risk of shock to the rescuer is very low. Cardiac arrest in children is rare and is usually caused by an airway obstruction or breathing problem. Although you may not recognize the exact age of a child victim's, AEDs can safely be used on anyone ages 1 and older. If your device has special pediatric pads, use them. Irregular cardiac rhythms like VFib or VTAC are rarely present in cardiac arrest from trauma. Trauma victims need immediate transport to a trauma center. Cardiac arrest in trauma victims is not usually associated with the kind of heart rhythm that would be helped by an AED. When in doubt, it's better to use the AED than not to use the AED. No harm will come from using it. However, it would be highly unusual for a trauma victim to be saved by the device unless the original cause of the trauma was a sudden cardiac event. Before attaching the AED electrode pads, remove any medication patches and wipe the skin clean. When exposing the chest, if you notice an implant, like a pacemaker or defibrillator, apply the pads around the implant whenever possible, although modern pacemakers can withstand the shock from an AED without problems. CPR and AED use can be withheld or discontinued whenever a victim or legal guardian wishes, especially when the victim has a valid do not resuscitate order. Periodic inspection of your AED ensures it will work well and that you'll have the appropriate supplies whenever you need to respond to a cardiac emergency. When you start the AED, it automatically runs through normal diagnostics and informs you if it is functioning properly. Be sure your supplies include electrode pads with unexpired dates, a spare and unexpired battery, a razor for shaving a victim's chest to attach electrode pads, and a towel to dry the chest if necessary. Check with the unit's manufacturer for specific AED maintenance requirements.